Riverside Pain Physicians.
October was Breast Cancer Awareness Month, and each year we all become conscious of and support many different causes for breast cancer. However, there are many other types of cancer that cause patients to live in pain. At Riverside Pain Physicians, they want to help their patients be active and to have the best quality of life no matter where their patients come from. Dr. Adam Cartwright is with Riverside Pain Physicians and is here to discuss the different types of cancer pain and what he and his partners can do for you or your loved ones who are suffering, unfortunately, with cancer. Thank you so much for being here. We appreciate it, Dr. Cartwright. Let's kind of dive into this because, and I think a lot of people at home know of someone who had either a family member or a friend, someone who has suffered with cancer. My grandmother, we lost her to cancer, and I remember that she was just in such terrible pain.
Yeah.
What can you, let's talk about that pain and how you guys can help.
Yeah, so that pain can come from several different sources. Sometimes pain can come from within a nerve itself, and oftentimes, lots of times the pain that people experience, unfortunately, is from a tumor or some other form of the cancer actually pushing on the nerve and compromising some of the space there, or it can be within a bone or in a joint, and all of those can unfortunately cause a lot of pain that the patients end up suffering from long term.
And it can be so excruciating that there's nothing that they can do at home to try to relieve that pain. So they have to go and see someone such as yourself, a professional who can really take an in-depth look at that. And let's talk about what you guys can do to help someone who's experiencing that sort of pain.
Yes, so it can be several modalities to try to help with some of that. And some of the things they actually can do at home, and sometimes we'd like to be able to show them how to do that either at home or through a therapist and some potential things they can do at home. But oftentimes there's either pain medications, you got the standard ones like hydrocodone or some of the other opioid type medicines. But there's several other, those are ones that most people think about, but there's several other ones that can be applied to such a situation, or doing things like nerve blocks, surgery, or even radiation, not necessarily to cure the cancer, but to help with the pain associated with the cancer.
Yeah, to make it easier on them while they're going through treatment,
Yes.
and that treatment is hard enough as it is. You don't need the additional pain on that if there's something that you can do to help with that. What do you think that cancer patients, if there is somebody who, hopefully not, suffering from cancer who might be watching this, or if somebody knows of somebody who has cancer, what do they need to know regarding pain control? What do you think is the most important thing?
Yeah, so I think a lot of people, while they're fighting their cancer and they're trying to be brave and do all these, trying to be tough while they're going through the cancer treatment that can oftentimes be very long and demanding, it's very admirable to want to be able to do that. And while you're fighting it, it's not necessarily a weakness to admit that you're having some pain along the way, because there can be several avenues that they could take to help tremendously with their pain.
And do you find that a lot of people who come into your office kind of wish they would have come earlier?
Oftentimes,
Why did I have to go through all that?
Yeah, it can often also be more common to, it's easier to treat the pain if we see it early on than it is to really get behind the eight ball and have to treat it after the fact. It can be very difficult at that point.
Okay, so and that's an interesting point. So if someone is saying, well, it's just mild, it's just a little bit of pain, it's better than go get help earlier on.
Yes, that's when you want to come see somebody.
Okay, before it gets too worse, and then all of a sudden, wish I woulda, coulda, shoulda. Being that we just got out of National Breast Care Awareness Month being in October, are there any issues related to breast cancer specifically that you think are important?
Yeah, so lots of times after
I'm almost done, baby.
women have a mastectomy,
Promise. Sorry.
even though initially they might not have much pain, they can have a lot of pain afterwards in something called post-mastectomy pain syndrome. And that can actually affect up to about 50% of women after they receive a mastectomy. And that's just characterized by a lot of aching, dull pain in the chest area that can be very bothersome.
And can you do something to help alleviate that?
You can. Unfortunately, there's not more surgery or blocks that oftentimes help with that, but so lots of times you have to use a lot of nerve-type pain medicines. So not necessarily the hydrocodone-type medicines, but other nerve-type medicines, not too dissimilar from people who are treated with diabetes and nerve-type pain in their legs.
Mm-hmm. And I know we're talking specifically about cancer, breast cancer, but you guys treat people who are suffering from pain, really any walk of life. I mean, everything from arthritis or just, I got this kink in my back and it hurts. I mean, you guys will take a look at that.
Yes, definitely.
Okay, so the best option is to go call and you can get a consultation, right? And just kind of
Yes.
see, hey,
Yep.
listen, what are my options?
And you don't even necessarily have to have a consultation. You can come in and just call in and make an appointment, and we'll set up the rest of that.
All right, Dr. Cartwright, well, thank you so much for being here. We certainly do appreciate your time, perspective,
you.
and everything else. And we would like to thank the Riverside Pain Physicians, of course, for coming on and sponsoring this segment. And if you would like more information about pain management, the physicians, their locations, you can go to riversidepainphysicians.com. Again, that's riversidepainphysicians.com. Their telephone number is 904-389-1010. They have 5 convenient locations all over the First Coast, so best to go to their website, find the one that is convenient to you, make an appointment, go in, and they say the best thing that you can do is do something to alleviate your pain today. Why have to deal with it, right, Dr. Cartwright? If you can do
That's
something
correct.
to make life easier.